One may be wondering what process we have put in place so that we have the right patient for the right procedure in our theaters. So before we bring the patient into the theater, we have to confirm the patient's name, the patient hospital number, and even the procedure. If the patient is awake and able to talk, then we have to engage the patient. Sign-in is done inside theaters before the patient is given anesthesia. Here also we confirm whether we have the right patient. Timeout is the most crucial one. This is done when the patient has already been anesthetized, patient has already been draped. So before the surgeon puts a knife onto the patient, then the whole team stops and then we confirm again. Here also we check on the site of the procedure. It must have been marked prior before the patient comes to the theater. The sign out is done when the procedure is done. Here the team again comes together and then discusses briefly how the operation went or whether there was any complication that came about. We have 3 operating rooms that can support procedures 24/7. We also have 1 cath lab that is yet to be launched. This is a state-of-the-art operating room with high-end equipment. This one is our lab tower. So we also have our anesthetic machine. We also have our operating bed. It is electrical and it is connected to the operating lights, which is also connected to the camera. So this means that when you're doing a procedure, then each and everyone in the operating room can also watch whatever is happening through the camera. We also have a diathermy machine, and this is used to control bleeding during an operation. This is our board where we usually write the count of the swabs and instruments before we begin a procedure and even after. This is a physical control panel and is used to regulate the temperatures in our theaters.
This is our post-anesthesia care unit, the recovery area for the patients. Once surgery has been done, we observe our patients here briefly before we can discharge them to the ward. If we feel they are stable for discharge, we have a criteria for discharging the patients. We observe 5 parameters. That is the blood pressure of the patient. We compare the blood pressure before surgery and blood pressure now after surgery. There's a criteria of scoring. The total score adds up to 10. So if a patient scores 8 and above, then this is the patient who can be discharged to the ward.